this segment is what's happening around the world, and yeah, it's clear that any of you that are watching the news daily and are looking at the number of cases coming in, that this growth of infection rate of the virus, and also sadly the number of deaths is still vastly accelerating, very much only going in one direction right now, despite a lot of attempts to slow it. And we'll come on soon to talk about some of those attempts and some of those successful attempts to slow the rate of transmission of the virus. A website I've been using quite a lot in conjunction with the worldometers that I discussed in the first episode is this interactive map by Johns Hopkins University. And if you look at their University of Medicine, you can go and find this very nice tableau, I think it is, display that's got the number of cases, the pockets around the world of how many infected cases there are. You see the graph in the bottom right that I've used recently to kind of show that exponential growth, so that doubling that we're seeing every few days. And yeah, you see the count of the number of deaths, but also importantly how many people are recovering. So if we look at the latest information as I record this video, we're at about 400,000 cases of the virus confirmed globally. Now, I'm sure many of you realize this, and it was discussed a lot at the last episode, but the actual true number of cases is likely to be far higher than that. Probably anything from 10 to maybe 20 times that estimate. So, 400,000 is a lot of cases. That absolute figure should be respected, but also we should have some healthy caution applied to that in terms of actually how many people have been infected by the virus. Of course, these are people that have been tested, and you have to be tested to confirm you have the virus. And a good subset of those 400,000 cases will be people that have severe symptoms. And that's why when we see the mortality rate is actually higher when you look at the data than probably it is in reality. And that's because we're not testing a lot of people with milder symptoms. So I think what's quite interesting is the evolution of this virus geographically. And over the past 24 hours, 85% of the new cases of the virus have come from Europe or the US. So they're very much the center now, and Europe and US are you see that in the figures, desperately trying to combat the virus as the number of cases continue to skyrocket. Of those 400,000 cases, we've seen now over 17,500 deaths. Again, sadly, a figure that's only going to continue to increase. And I think what's increasingly important is the variety of those deaths. Of course, we still know statistically those that are vulnerable to the virus, the elderly population, but also those with the underlying health issues. They are, of course, the most likely to be the ones that are dying from the virus. But now we see increasingly, as this number of deaths increases manyfold, we see that younger populations, healthy people, etc., are being infected by the virus and going on to die as well from the virus. So, there is nobody out there that can be sitting there thinking they're invincible and completely immune to the virus, though I'm sure many people who have caught the virus and successfully fought it will have at least started to take steps towards getting immunity from that virus. We've had 100,000 recoveries, which is obviously fantastic news. So of those 400,000 cases, 25% of them have been full recoveries, and that number will just continue to increase. So again, people are recovering in their own homes. People are recovering from milder forms of the symptoms. But actually, a lot of these recoveries that are being reported here are obviously recoveries that are of people that are already in the health system, recoveries of people that have got sort of more major symptoms or very, very, very severe symptoms. So it's fantastic that we see, how powerful the healthcare system is at combating this virus, albeit there's not an awful lot we can do. And that's why things like the ventilators are so important to kind of give people the fighting chance of battling the virus. But you see that there's been a huge number of people that have successfully managed to recover from probably quite severe symptoms of the virus. So that's a complete testimony to how well the healthcare services around the world are working night and day to tackle this. In the UK specifically, we now have 8,077 cases, of which 422 people sadly have died. And I think, again, I talked a second ago about the NHS, and broader the healthcare providers around the world that have helped create those 100,000 recoveries. And I saw a statistic today from the BBC that said that 7,563 clinicians have now responded to a call to arms, essentially to return to the NHS, having obviously been outside of the NHS. Many people do obviously move on to other careers, so it's fantastic to see so many people coming back in. And again, I hope more people will do that, even non-medical professionals, in this call to arms of this 250,000 volunteers that the NHS is trying to recruit, again, to help tackle the virus. India has now gone into full lockdown. Again, it's not that surprising when you look at the state of the world, India's proximity to China, the number of people in India, India's record on preventing health issues, etc. It's definitely a country, when you look at it, that would be potentially exposed to a virus. But again, it just shows that the data can't be 100% trusted. I mean, if you look at the data, I think the number of cases of the virus in India are around 500. And again, we talked about it in the first episode. It's very much a reflection of just how few tests have been done in many countries around the world. So India have now gone to full lockdown, and we heard earlier from Japan that the Olympics has been postponed until next year. There was a lot of pressure from the international community to make that happen. I think Japan have tackled the virus extremely well, and we'll look at Japan later in this episode. But I think if everybody had responded the way Japan had done, then just maybe the Olympics could have gone ahead after all. And I think a very interesting and unfortunately a very sad statistic from Spain. Again, this was being reported via the BBC today, and that's that of 14% of all the cases in Spain, right? And I don't have the figures right now. Let me just have a look, because again, the situation in Spain continues to get worse every day. We're very much seeing Spain follow in the footsteps of Italy. The situation in Spain, they've got about 40,000 cases, and unfortunately 2,800 deaths. Also, I see here that the number of deaths in the world now has gone up to 18,250. So this number just keeps increasing, unfortunately. Again, it's not to be, it's not exactly unexpected, but again, I think to me every death kind of just makes you realize how serious this is. Now, nearly 20,000 people have died from this around the world. That number's only increasing. Yeah, so 14% of total cases in Spain, so that's about 1 in 6, right? About 1 in 7. It's a lot of cases, yeah. I'm trying to do the maths now in my head. It's around about 7,000 cases, a little bit more. About 7,000 cases in Spain are to do with healthcare workers. So it's not surprising, right, that people that work in healthcare are the ones being infected. That's unfortunately a harsh reality. It's also sad to hear accounts from friends that talk about how, a lot of the equipment, just in terms of basic, hygiene and etc., that the doctors not usually have, like the face masks, etc. They're being given to the patients to combat the virus, and often it means that the people that are working and the people we need to keep healthy, we have to keep fit, because they're the ones that are going to break through in attempts to stop the virus. They're often the ones now that don't have the equipment, they don't have the kind of safety measures that they normally would have, and so it's sad that unfortunately a lot of people that are helping and working so hard to prevent the virus and prevent people from dying from the virus are unfortunately going to end up potentially dying themselves. So I think that's sad. Okay, so yeah, it's a very gloomy, stark picture. I kind of apologize for that, but yeah, that just is it. That's the numbers, it's the facts.